Thank you for joining us on this Friday evening. I'm Rob Hagan.
And I'm Kyra Isaacs. In our top story, a contentious D51 school board meeting ended on Tuesday in a controversial decision to vote down the proposed addition of an on-campus Marillac health clinic.
KREX 5's Danny Condon met with Marillac's CEO to find out more.
District 51 board members weighed installing a health clinic in Grand Junction High School's new building, as KREX took an in-depth look at Central High School's health clinic, Marillac Clinic. By every measure, the clinic is a resounding success, serving nearly 5,000 students between 2020 and 2022.
We give the educators what exactly they're looking for: higher attendance, healthier kids, higher performance, less depression, anxiety.
And yet, during Tuesday's contentious board meeting, the three most recently elected board members pitted themselves against a clinic that could have helped thousands of GJHS students. They cited a lawsuit against Marillac, but the suit had nothing to do with the operations at Central High School. Instead, it was a follow-up suit from an employee who had filed a now-dismissed discrimination case against Marillac.
She lost the case, and the outcome was in favor of Marillac. Basically, they told the employee, you were never discriminated against.
Longer-standing board members accused Andrea Heights of making up her mind before the dismissed suit even came up. And Heights admitted that was true.
My mind was made up prior to the lawsuit.
Oh, I know it was.
Marillac CEO K. Ramachandran says the rejection only hurts kids who would have had free access to physical, mental, and even dental treatments.
The phrase I use is basket of services. You're mandated to provide a basket of services. The bulk of the services in the basket require parental consent.
And the few services kids may have accessed without parent permission, reproductive health, behavioral health, and a select few vaccines.
I did propose this to the school board, and I've never to date got a response from them. I said I am willing to carve out all the services that require minor consent and not provided on the premises.
Board President Andrea Heights told meeting attendees that Marillac was welcome to locate down the street.
They get grant funding for their other locations, is what they told me. They just wouldn't be getting the school-based health funding.
If the clinic is off campus, it doesn't qualify as a school-based health center. So I cannot access federal funds, I cannot access state funds, which is the foundational funding for a school-based health center.
And as it turns out, not just any school can get an on-campus health center. Grand Junction High School and others must qualify based on the number of free and reduced lunches and high-risk youth behavior, which usually come along with low performance, poor health, and delinquency, which is exactly why schools like GJHS need the health clinic. Just like Central High School, GJHS met the criteria, and the center wouldn't have cost D51 a dime.
It was going to cost them nothing, just the space. And I would have paid fair market value for it.
The D51 board was already under fire for a last-minute public disclosure it would close 3 local schools against the wishes of thousands of staff, students, and parents as soon as this fall. Its latest move, to slam the door on a nonprofit health center already proven to help thousands of students most in need, adds fuel to the public scrutiny that board members once demanding transparency may not have been transparent in their own reasons for voting the clinic down. First on the Western Slope, I'm Danny Condon, KREX 5.